I am Aniruddha Chakravarti, and I'm a consultant urological surgeon with special interest in robotic surgery of kidneys and laser surgery on prostate. I work in Royal Wolverhampton Hospital as my NHS-based hospital. I wanted to become a doctor since my school days, and I wanted to become a surgeon very early in my medical school days. I do like challenges, and that's probably provoked me to, not that I'm saying that there are no challenges in non-surgical specialties, but yeah, I mean, probably I'm more gadget oriented and like intervention, like challenges. Yeah, that's why I chose to become a surgeon. So I went through the full training program in general surgery in my country where I graduated from. And in those days, in my country, the program included a little bit of urology as well. And on completion of that training program, we were fully proficient in general surgery. And also we had an introduction to several other subspecialties, which we could further hone in as a special interest or just be a general surgeon. But the exposure in urology evoked my interest in urology, and I wanted to further subspecialize or super specialize in urology. And therefore, I continued with urology mainly after being trained in general surgery. I grew up in India, and my basic medical training, medical school was India, in a city called Calcutta. And that's where my medical schooling was, my basic medical training was, and my whole training in general surgery was. My whole urology training has been in the UK. I came to UK when I was trained in general surgery, but just had an introduction in urology, not fully trained in urology. So I started from the bottom, training in urology in UK, and I have completed full basic and higher training in urology in the UK. The most rewarding is patient satisfaction, when you can achieve what you want to achieve and the patient wants to achieve. When you and the patient have a common goal to achieve in the best interest of the patient, and you do achieve that, and you get a very satisfied patient who is happy with the outcome, and he or she gives you the feedback, that is the best you can get out of your profession. Well, I think what patients value most or look for most in doctors is somebody they can trust, somebody who has a caring attitude and thinks in their best interests. Yes, the basic catchphrase or mantra, as you say, is one size does not fit all. So treatment has to be tailor-made for the patient, and it's work in the best interest of the patient, not your best interest. That is the mantra. A person in my profession should be caring, honest, and act in the best interest of the patient.